My presentation today is going to be on telehealth and the rare disease community, specifically changes to telehealth during COVID and how they have impacted the community. So first, what is telehealth? Telehealth is the distribution of health-related services via electronic information and telecommunication technology. So this basically means the ability to have an appointment with your healthcare provider over your phone, on your computer, anywhere that is long distance. So prior to COVID, telehealth was seen as an extra service with restrictions and limitations. And that has changed since a public health emergency was declared. Federal and state governments have provided significant waivers and are taking new actions to expand telehealth, including the White House issuing an executive order on telehealth expansion on August 3rd of last year with a focus on rural areas. And Congress gave the Department of Health and Human Services and the Centers for Medicare and Medicaid Services the authority to expand who, where, and what types of telehealth services can be provided by Medicare while expanding communication methods for telehealth. Many states have also issued waivers, new legislation, and executive orders to expand telehealth access, including licensure flexibilities to allow providers to practice across state lines. So how does all of this impact the rare disease community? Access to care is especially difficult for the rare disease community outside of COVID. Examples of this include the need to see multiple providers and specialists to receive a diagnosis, the cost of traveling to multiple providers, and the lack of specialists can create geographic challenges. So telehealth has been able to alleviate some of these access issues. Additionally, temporary changes to CMS's home health policies have enabled rare disease patients to utilize essential but previously unavailable home health services during the pandemic. An example of this is when CMS temporarily changed the definition of homebound to include individuals who have a condition that puts them at a greater risk of COVID. So while this wasn't necessarily an action geared specific towards the rare disease community, it has allowed members of the rare disease community to access their providers remotely while reducing the risk of infection of COVID. So whenever we're talking about policies or policy change that impacts the community, I think it's always important to hear from advocates and caregivers who this would impact. So I contacted a few of our advocates and asked them how the changes to telehealth during COVID have impacted them and their families. So this first quote is from Kelly Maynard. She is an advocate, caregiver, and our Community Congress Access Working Group co-chair. Kelly said, telehealth during the pandemic has been a game changer. Not only does it allow us to keep our kids who are immune compromised safer, but it increases access to care in certain specialties that didn't exist prior, like access to behavioral and mental health providers that were critical to us during the pandemic. Traditionally, this area of care has only been available to those patients and caregivers who can afford to travel to clinics if there were no such providers in their area. The availability of telehealth changed all of that for the better. Then I also contacted Shelly Bowen. Shelly is an advocate, caregiver, and director of family services and advocacy at the Barth Syndrome Foundation. When asked the same question, Shelly said, for a parent of a chronically ill child, telehealth has been extremely beneficial. One example would be avoiding risk from exposure to communicable illnesses, particularly for high-risk immunocompromised children. For some children, going to the doctor is no small undertaking. A 30-minute appointment plus wait time and travel time requires a parent, food, medication, and equipment. Telehealth appointments have been life-changing for parents, patients, and doctors alike. So what happens to these temporary changes after COVID? Many of the flexibilities are at high risk of going away when the COVID-19 public health emergency ends. In order to address the needs of the rare disease community, telehealth must be kept in place post-COVID. And a few bills have been introduced in the House and the Senate to create some concrete telehealth guidelines. However, it's important to discuss what the rare disease community needs from these bills, because there are lots out there, more than I was able to include in one presentation. So the rare disease community supports telehealth policies that remove arbitrary restrictions on patients' locations, that empower CMS to determine appropriate telehealth providers and services, that extend the telehealth waiver authority to any public health emergency, and that allow rural health clinics and community health centers to offer telehealth. So the first bill that we're going to discuss is the Expand Telehealth Access Act, which has only been introduced in the House. This bill permanently allows audiologists, physical therapists, occupational therapists, speech language pathologists, and other providers designated by CMS to provide telehealth services under Medicare. So this policy has been temporarily put into place during COVID, but it is set to expire. And the basic purpose of this bill is to expand the scope of practitioners who are eligible to participate in telehealth. Next, we have the Connect for Health Act. This has been introduced in both the House and the Senate. This bill expands coverage of telehealth services under Medicare by allowing CMS to waive certain restrictions, such as restrictions on the type of technology that may be used during a telehealth appointment. This bill would also permanently remove geographic restrictions on originating sites and allow the home of the patient to serve as the originating site for all services. So in this scenario, the originating site is referring to the location of the patient during the appointment. So this would permanently remove any geographic restrictions on where the patient can be located. It also allows federally qualified health centers and rural health clinics to service as the distant site. And the distant site is the location that the doctor or the provider is at. So this would also make telehealth easier for those in rural areas to access. It also allows CMS to waive coverage restrictions during any public health emergency moving forward. Next, we have the Telehealth Modernization Act, which is both in the House and Senate. This bill would ensure that patients can access telehealth services anywhere by permanently removing Medicare's geographic and originating site restrictions, like we just discussed. It also protects access to telehealth for patients in rural areas by enhancing telehealth services for federally qualified health centers and rural health clinics. It would also give the U.S. Secretary of Health and Human Services the authority to do three new things. Help patients continue to access telehealth from physical therapists, speech language pathologists, and other healthcare providers. Help give Medicare recipients more telehealth services, and help Medicare, hospice, and home dialysis patients use telehealth to continue receiving necessary care. And lastly, we have the Protecting Access to Post-COVID Act of 2021, which is only in the House. This bill establishes the patient's home as an eligible distance site so that patients can receive telehealth care at home and doctors can still be reimbursed. It authorizes CMS to continue reimbursement for telehealth for 90 days beyond the end of COVID in order to prevent a sudden loss of telehealth services. It enables HHS to expand telehealth and Medicare during all future public health emergencies. And lastly, it requires a study on the use of telehealth during COVID, including its costs, uptake rates, measurable health outcomes, and racial and geographic disparities. And the survey is a really important piece because it's necessary to make evidence-based decisions on the integration and expansion of telehealth moving forward. So that's a lot of information. So just to break down a nice comparison of these bills, I've included the categories I mentioned that the rare disease community supports in a telehealth bill at the top of the chart. And then you can see each of the bills that I just mentioned listed on the left-hand side of the screen. So all of the bills would remove arbitrary restrictions on a patient's location. So that's great. Only 3 of the bills would empower CMS to determine appropriate telehealth providers and services. Protecting Access to Post-COVID Telehealth Act is the only one that would not. 2 of the bills, the Protecting Access to Post-COVID Telehealth Act and the Connect for Health Act, would extend the telehealth waiver authority to any public health emergency. And then again, only 2, the Connect for Health Act and Telehealth Modernization Act, would allow rural clinics and community health centers to offer telehealth. So looking at this chart, you can see that the Connect for Health Act of 2021 is the bill that met all of the requirements that I mentioned previously, and it also has the most support in both the House and the Senate. And I think it's really interesting to mention that all of these bills have bipartisan support, and all of them do have strong support in both the House and the Senate if they're introduced in the Senate. So that looks great moving forward. So what's next? Congress and the Biden administration must act to ensure that patients, especially those with a rare disease or underlying condition, continue to have access to home health and telehealth even as COVID ends. I think it's important to also mention that these bills are unlikely to pass before the end of the year. So it is important to engage with your member of Congress to express your support, not even for a specific bill, but just for telehealth in general, because Congress is going to have a lot of work to do on this when they return at the beginning of next year. So you can contact your member of Congress and engage with them by calling their district office or their Washington, D.C. office, or by sending an email to them. You can get both those phone numbers and their email address off of their official website. You can also complete an action alert and have an automated message sent to your member of Congress. So a lot of health nonprofits and rare disease organizations support many of the bills that I just discussed. And so you can see here 2 links that lead to action alerts where you just put in your information and an automated message that's already written goes straight to your member for you. So that is a nice, easy, quick, and effective way to engage with your member. And lastly, you can post on social media in support of permanently expanding telehealth, and be sure to tag your member in anything that you do post. So I encourage you to keep in touch with us. If you're not already, please sign up for our RDLA newsletter, action alerts, and event invitations at rareadvocates.org. I also encourage you to follow us on social media. We post policy updates, event updates, all kinds of good information on how to get involved. And you can see all of our social media handles here. And if you have any questions about any of the information that was provided in this presentation, you can contact me. My email is listed here. You can also contact RDLA Director Shannon Von Felden or Director of Public Policy Jamie Sullivan. Thank you.